A 76-day lockdown of Wuhan, the epicenter of the coronavirus outbreak in China, is now over. For the city's 11 million residents, to say it has been an ordeal is an understatement. Only they know how much discipline and perseverance it took to get here. And now, there could be some comfort in knowing that they did not suffer in vain. On March 31st, 22 top health experts from 15 research institutions, including Harvard and Oxford, published a study in Science magazine. Their research found that without the Wuhan lockdown, by February 19th, day 50 of the epidemic, there would have been 744,000 infections outside Wuhan. But in reality, the number was capped at 29,839. In other words, there were 96% fewer cases due in a large part to the lockdown. Let's face it, sealing off an entire city is harder than it looks. In America, for example, New York State Governor Andrew Cuomo fiercely rejected President Donald Trump's hint of a statewide quarantine.
Oh, well, look, a lockdown is what they did in Wuhan, China. I don't believe it would be legal. I believe it would be illegal.
In Europe, even though lockdowns were announced, online videos showed several mayors in Italy getting frustrated with those who refused to obey government orders.
Dovete stare a casa! Non avete capito che la gente muore! Volete far ammalare tutti!
Some mayors had to go to the streets themselves to plead for compliance.
Non potete stare qua, andiamo. Non vi guardate così, dovete andare a casa, è vietato, dovete andare a casa. Andiamo. Voi non è previsto il ping pong, non potete giocare a ping pong, andiamo. Alla PlayStation.
Back in China, Wuhan's experience showed that a few things need to happen for a lockdown to be effective. First, it needs to be verified and rigorously enforced. In Wuhan, police, community patrols, party officials, and volunteers were recruited from across the region to implement the measure. They were warning, deterring, and occasionally punishing violators. Meanwhile, in virtually every single community, volunteers went door to door in apartment buildings to record temperatures, while medical staff traced and tested suspected virus carriers. 3 weeks into the lockdown, 99% of the city's residents had reportedly been screened or tested. Secondly, there was a massive nationwide top-down mobilization. Now, this may sound insane, but on average, it took less than 2 hours to assemble a medical team and less than 24 hours for it to be dispatched to Wuhan. Eventually, over 40,000 doctors and nurses from the Chinese military and other parts of the country went in to help. On top of that, it took just 10 days to build a 1,000-bed hospital and 1 day a makeshift hospital. Finally, the latest technology was deployed. In Wuhan and across China, big data and artificial intelligence were used to track down those who defied quarantine rules. And mobile apps were developed to separate healthy people from those at risk. Even now, only people with green QR codes on an app linked to a color-coded health system can leave their city of residence. Meanwhile, drones were utilized to monitor and alert the public to stay safe.
对面那个电动车上装着粉色挡风被的大哥，请你戴上口罩啊，戴上口罩。打电话那帅哥，你口罩呢？抓紧给戴上。
Of course, there were concerns about privacy, but many Chinese said that in times of crisis, they're willing to deal with some personal inconvenience for the sake of the greater good.